The MDR-TB partnership is a collaboration among multiple stakeholders, including the National Department of Health, Johns Hopkins University, Jhpiego South Africa, along with our mHealth platform, eMocha, and the NHLS. So the partnership's purpose is to address critical questions in linkage to evidence-based care, specifically getting patients into care as quickly as possible to meet the goals of the National Strategic Plan of South Africa.
From the beginning, I wasn't having that much experience on MDR. So when this job came, it was a scary thing for me because I heard some stories. But as the time goes on and when I started now initiating patients, I really find out that I shouldn't be scared because these patients are already been diagnosed. So the patients which are more scary are the patients which you still not yet known what you are treating. So at that stage, I felt so honored and I started liking the program, and I have a passion. I said to myself, well, if it happens like this, to see a patient which was so sick coming to me and I initiate the treatment and then it becomes successful at some stage, I felt very honored. And by being praised by the patients now and again, that made me felt so good.
South Africa is ranked the 4th highest of the high-burden countries worldwide. In 2013, we had approximately 15,400 new MDR cases. The biggest challenge that we have is basically that we haven't got enough beds for these patients. So within the National Strategic Plan, they've made provision for a decentralized approach. That means that you take the MDR-TB treatment to the communities. The benefit of this is that our default rates will come down and that you will basically have a more human approach to the MDR-TB problem.
So in addition to linkage to care, access to convenient care is a critical component. And we do this through a nurse initiation type model, where care is delivered for MDR-TB at the lowest possible level at the primary healthcare clinic, so patients can have access as close to home as possible.
The staff at Murchison were very supportive. Like, I had a lot of fear, so with any questions I had, I knew that I had to phone Sister Kaya. Then whatever queries I have, I just ask the doctor and he explains everything in detail.
You have to have a passion with the program, and patience is very important, because if you don't have patience when you treat those patients which are coming to you, at the end, even yourself, you won't be doing very well. So firstly, you have to love the program, and then understanding the different situations, especially when the patient comes. Some of the patients to come with a different cultural background. So you have to have a clear understanding, at least to learn in that particular area, what exactly is their cultures, what are the things which they value, so that when any client comes in front of you, you are in par with that client.
MDR is curable. There is treatment. You take treatment for MDR, and if you take your treatment good and you take care of yourself, MDR is curable. They mustn't be scared. It's just like any other disease.
So I think it's important that we emphasize that there's critical country ownership of this program, whether it's through our partners and our stakeholders at the National Department of Health in the Drug-Resistant TB Directorate, or at the provincial and district level. We also know that the MDR-TB hospitals that are involved in our initiative are critical to the success of this program. And as we roll out from facility to facility across the country, we know that the clinicians working in those environments will be instrumental to the success of this work.